Epilepsy is a symptom of nervous system dysfunction. It is frequently accompanied by, but is not the cause of, mental deficiency. Epilepsy is characterized by recurrent attacks of loss of consciousness, usually accompanied by convulsions. This girl illustrates petit mal epilepsy. Her sister, too, has petit mal epilepsy. Petit mal seizures are usually frequent, but rarely dramatic or injurious to the patient. They may occur only occasionally, or as often as several hundred times a day. As time goes on, however, petit mal seizures tend to become more severe and frequent until they resemble grand mal attacks. Petit mal attacks are characterized by a momentary drooping of the head. It seldom lasts longer than 15 seconds, and the patient rarely falls. Here, the smaller girl is having a seizure. Probably 1 million people in the United States are afflicted with epilepsy, of whom only a small proportion are mentally defective. While epilepsy was one of the first disorders to be described in medical literature, only recently has real progress been made in understanding the condition. Again, the girl on the right has an attack. It is more pronounced this time. Now she has another attack, during which she almost falls. This subject has several hundred petit mal seizures every day, occurring almost continuously. For the purpose of this demonstration, she is asked to breathe deeply. This produces an alkalosis in the blood, which tends to increase the number of convulsive seizures. Epilepsy is classified as either idiopathic or organic. In the idiopathic type, the cause is unknown. In the organic type, some definite abnormality is present, such as a congenital defect or an injury to the brain. Most cases that are properly diagnosed as epilepsy are of the idiopathic type. Predisposition to this disorder may be inherited. Attacks of the petit mal type follow one general pattern. There is a sudden lapse of consciousness, during which there is a vacant stare and fluttering of the eyelids. If the patient is doing anything when the attack occurs, there is a momentary cessation, then a continuation of the action, often without the person being aware of the interruption. There is evidence to suggest that the normal physiological interchange of fluid and electrolytes in the brain cells may become disturbed, and that this is responsible for the interruption of the normal brain rhythm, which is now thought to cause epileptic seizures. This man has the more severe form of seizure, known as grand mal epilepsy, which he has had for many years. He is also mentally retarded. His nose is deformed from many falls. He has kept a record of his many seizures and is now showing a page in his daily record book. It indicates 21 seizures one day and 18 another. The patient shows us his monthly and yearly records of attacks. He is very proud of the fact that he holds first place in this institution for the number of convulsions. Grand mal seizures are more severe and generalized than petit mal. In grand mal epilepsy, there is usually a period just preceding the attack when the patient experiences a disturbing sensation known as an aura. During this period, a definite change from the normal brain rhythm occurs. When the attack begins, the patient usually utters a sharp cry, and if standing or sitting, suddenly falls. This man's attacks are not as violent as is usual because he is under treatment. Many types of treatment have been suggested in the past, but at present the most satisfactory treatment is provided by anticonvulsant drugs. In the organic type of epilepsy, operations to remove pressure, adhesions, tumors, or cysts from the brain have been beneficial in some instances. In a typical grand mal attack, marked pallor is followed by deep cyanosis. The body is rigid at first, Then clonic spasms of the muscles cause the limbs to jerk in a typical convulsive movement. These quickly involve the head, trunk, and limbs. The eyes roll upward or deviate to one side. The pupils dilate, and the facial expression becomes distorted. After a remission of a minute or less, the convulsions are usually repeated. The entire seizure may last for several minutes. Then the patient will usually sleep.